Hey, this is Dr. Ty from Premier Orthodontics. So on our channel, we get lots of questions in the comment section. In this video, we're going to be answering some of these questions, hopefully give you some more insights on some of the more common questions we get about orthodontics. So if you haven't yet, make sure to like the video, subscribe to the channel, and tap the notification bell if you'd like to get notified when we release new videos. All right, this question says, "Hi doctor, I went to the orthodontist. They said I was most likely born with an underbite. My bottom teeth are straight and the top left is not so much. I wanted to fix my underbite, but I'm 17 and they said jaw surgery would be the best case. I told them I didn't want any surgery. I was wondering if I can just get 4 teeth extractions, 2 on top and 2 on bottom. If it would bring my bottom teeth back, and I can also use elastics and braces to strengthen and fix my underbite by pulling my bottom teeth back a little bit with elastics. Thanks, I'm scared that the only way to fix my bite is by surgery. Also, I asked him if I can just straighten my top teeth instead of fixing my bite because I am fine with it. He said if I were to only straighten my top and bottom would grind on each other, making it hard to eat, etc." All right, so this is a really good question. There's a lot here, so we're going to go through it step by step. So some people are genetically prone to have an underbite. It's just kind of programmed into your genes, and that's how you grow. Usually it's, you have parents or family members that have that underbite. And basically, it's either your lower jaw just grows too much or your upper jaw doesn't grow enough. There's not a lot to do to change that. As far as can it be fixed without surgery, that depends on how severe your underbite is. So your teeth have to sit within the jawbone. We can't move the teeth outside of that jawbone. And so teeth can kind of move forward or back about 5 millimeters. So if you have a 10 millimeter underbite, you can't move your top teeth forward 5 millimeters and bottom teeth back 5 millimeters. If you try to do that, you'd be hitting edge to edge. That's just kind of the math behind it. So if your underbite's more than 9 or 10 millimeters, in order to successfully fix that without surgery is going to be really, really difficult. Just because you can't push the teeth outside of the bone, then you won't have the teeth sitting in anything, and that's not possible. So if your underbite is to that severity, moving the jawbone is the only real way to get it fixed. It is something that, not a lot of patients do. It is, a big deal to get jaw surgery, but if you have a severe underbite, that is going to be the absolute best method to fix it. So it is always an option to just straighten your teeth and not fix the bite. So I've had adult patients come in that have had just that exact treatment. They're 34 now. When they were 16, their parents couldn't afford jaw surgery or didn't want jaw surgery. So they elected to just straighten the teeth. They left the bite as is. And then 20 years down the road, that person decided they wanted to go ahead and get the bite fixed. So it's something that can be done later on when you're older. And so that's an option if you just want to get your teeth straight, leave the bite as is, you're not worried about the underbite. You can definitely do that now. And later on down the road, if you decide you want to get that fixed, with a surgical option, that is still an option for you. If it is like a mild to moderate underbite, that sometimes can be fixed either with extractions, with rubber bands, with springs, different appliances. But it has to be within that window of, can I move the teeth enough within the bone in order to get full correction? If the answer is no, then we either have to move the bones or just leave the bite as is. So definitely ask your doctor as far as which is going to be an option for you. And hopefully they can get you a good option that works for you. At 17, sometimes if you're a young man, your jaw keeps growing until you're like 19 or 20. It really depends on when you're going to stop growing. If you're female, usually you're done growing. You can proceed right now. But hopefully this helped give you some insight, and definitely ask your doctor for more specifics about your treatment. Hopefully you found this video helpful. If you did, give the video a like, subscribe for more braces related content. Make sure to tap the bell for notifications. And if you have any questions you'd like to have answered, ask them in the comment section below and we'll do our best to answer. Thank you so much for watching. We'll talk to you soon.